25 years of fearless and impactful journalism. Good afternoon and welcome to the Midday News. This bulletin is coming to you live from the Joy 99.7 FM studios here in Accra. Our digital address GA0993341. Also live on Love 99.5 FM in Kumasi. Affiliates across the country, including Volta Premier in Ho, A1 Radio in Bolgatanga. It's on ABN Radio in London and around the world at myjoyonline.com. The news is brought to you by UMB Bank, UMB Speed Up, Digibank, Let's Go, and Teleso 4G. Just a touch. In this edition, COVID-19 patient from Guinea put in quarantine in Tamale escapes. We'll bring you details as police launch a manhunt for him. And on day 2 of lockdown, soldiers and police step up security checks in Accra amid concern some individuals may be abusing the rules of the restrictions.
But they haven't given us any ID card yet, so it started today because I went to work without this.
We'll hear from the police warning commercial drivers to comply or risk punitive action.
Today, there is much activity, clamping down on their activities and redirecting them to go back. They are also carrying a lot of people who have no business under special conditions.
Also, over 30 head porters discovered on board a cargo truck ready to be moved out of Accra.
When they saw this vehicle, they were quite curious to look into it. So they approached the vehicle only to open it and then find a lot of women being carried with their kids parked in there.
Ghana Health Service to begin house-to-house testing of people suspected to be carrying the coronavirus in high-risk communities in the Ashanti region. We are live there in sports.
Ghana's amateur boxing coach Ofuriasari is looking at using the extended time to build a capacity of his 2 boxers who have qualified for the Olympics set to be staged in July next year.
And also later in the bulletin, the singing campaign to raise awareness about COVID-19.
There comes a time when we hear a certain call, when the world can't come together as one. There are people dying. It's time to us and to prevent world disease right now.
That's all coming up here on the Midday News. You want to stay for details with me, Emefa Apawu. Thanks for staying with the best. Let's settle for details now. We start off from the northern region where we are learning that a COVID-19 patient has escaped from quarantine. This individual is said to have been part of a number of Guineans who tested positive for the virus and were being held in isolation. Yesterday, you heard the Northern Regional Minister tell us that about 40 of these persons were currently in quarantine, monitoring the situation. Thankfully, he joins us again on the line. Mr. Salifu Said, we are grateful for your time once again here on the Midday News. So how did this happen? We're told about a patient who has escaped from quarantine.
Yes, thank you, and thanks to your cherished listeners. It's a very challenging moment, despite the fact that we have put in all the necessary measures to ensure that the 10 confirmed victims of the coronavirus has been kept safely. The youngest among them, who is about 21 years old, managed at late in the night, whilst the people along the line were deep asleep. She managed and scaled over the wall without picking any of her belongings, including her phone. All everything is in her hotel room. So we quickly met yesterday as RESEC, and the security has been detailed across. We have also gotten some key opinion leaders to see to it that they monitor their area. When they see any strange person of that age, they quickly report it. So that is the situation with regard to that.
But didn't we have security at this place that you were quarantining those people? How did it happen? That's the concern.
Yes, we actually ensured that the security, they assigned 2 police and 2 military at the hotel, and they were guiding the place. So, but we are working very hard, and the security are working to get back.
So, as we speak, you've launched a manhunt. Do we have any suspicions as to where she could be?
For now, we cannot confirm, but she will still be within the vicinity, because given the fact that She's a fairly young girl. At the same time, no any other. But she didn't pick anything or any of her belongings, her everything, even including her phone.
Interesting situation, but we know that there could be exposure at this point, knowing that she's tested positive. How are we ensuring that there could be a minimal spread, if I should say?
Yes, that is what we are also. I was compelled to also relay it to the public so that people will take precautions. If they see a very strange young girl at that age, they don't know her, they shouldn't temper to get closer, and they should interrogate her before. So we are very hopeful that we'll be able to get her.
Well, I'm still confused a little about where the security people detailed to this facility were at the time that this incident occurred.
Yeah, so the security to the commanders are also on them. So because of that, they have beefed up security to ensure that such a gap or lapse doesn't occur again. So, but that notwithstanding, they are also aggressively, we are looking and searching for the girl.
I'm sure that has been investigated as to why there was this lapse, right?
Yes. The security commanders are taking the people on duty on that, and they are investigating them, and they will ensure that appropriate measures will be taken in place.
Very well, we're grateful for your time. That's the Northern Regional Minister, Salifu Syed, giving us an update on how a COVID-19 patient has escaped from quarantine. Now, she's part of a number of Guineans who tested positive for the virus, and we're being held in quarantine in a facility in the region. Currently, a manhunt has been launched to look out for her. Now, it's day 2 of the enforcement of the restrictions imposed by President Akufo-Addo following the coronavirus spread in the Ashanti region and the Greater Accra region. Throughout the capital, Accra and Kumasi, police and the military have stepped up security checks amid concerns that some individuals may be abusing the restrictions. Joy News reporter Emefa Apawu spoke to those people on the streets in Accra. I'm going to my sibling just across the street. But what do? I sell materials in town, but I'm only going to take money from my sibling today because I have nothing at home. I've used all I have for household supplies already.
I'm going to work.
Where do you work? Okay.
But they haven't given us any ID card yet, so it started today because I went to work without this. So it just started.
But
so
you didn't have anybody check you?
No. I didn't do anything like that. I'm going back because they said I should go back.
Now, Director of Operations of the Accra Regional Police, Superintendent Kwesi Fori, says they are clamping down on all trotros in the capital because the drivers are refusing to comply with the spacing directives. My colleague Emefa Apawu joins me on the line now with details. So, how exactly are the people abusing the directives according to the police?
Yeah, hi. The police are clamping down these vehicles in the capital because they have failed to comply with directives by transport operators in the country. You remember the statement issued by these operators a few days ago asking all drivers to practice good hygiene and ensure they pick up specific number of people. Well, all of this, according to them, are not being done, making their work very difficult. What I observed when I went to the town is that most of them had more than these number of people. They had 4 in a row, which is not supposed to be. There are supposed to be 2 people in a row. So this is why they are clamping down on those vehicles.
Yeah. But you've been interacting with the police, especially Mr. Kwesi Fori. What exactly has he been telling you?
Well, he said that day 1 of the exercise was difficult because most of the drivers obviously were not complying with the directives. They had more people in their vehicles. And so day 2, they decided that they are going to be tough on them this time around because they are not compliant and it's going to affect the people in the vehicles. They stop you and they ask you where you're headed to. I mean, not just the driver, but the passengers as well. So most of them had no excuses. They were just in the churches. They were going somewhere. They were not going to the hospital or going to work or going anywhere. There were the excuses that they gave the police. They didn't they couldn't take it because there weren't good excuses. So they decided that no, they are not going to allow that. So they are not going to allow them to operate.
We review our activities yesterday, and we've noticed that the trotro drivers are taking undue advantage of the offer given them. In view of this, today there is much activity, clamping down on their activities and redirecting them to go back. They are also carrying a lot of people who have no business under special conditions, like being employees of some vital organization like the Ministry of Health, Electricity, Water, Security, among others. But rather, we've seen that a lot of people are trooping into the city, just coming around to loiter. And we are also doing away with this kind of people, making sure that they go back home and be safe. So it is a grand security operation going on. All the 14 divisions in Accra, all the regional operation groups and the national, we are together, acting under this directive to make sure that we contain activities of the trotro drivers and make sure that we are able to gain grounds in the city center. So far, we've also advised market women who at some locations which poses danger to their health and security to go back home. At the same time, we are also encouraging trucks, vehicles carrying food, medical supplies into the city to satisfy the needs of our people.
So you're saying the churches, does it mean that the taxis are doing the right thing?
For now, as I said, it is an ongoing exercise, and we are reviewing every step taken, and every step taken. We've not come on the taxi drivers yet, but we've identified the trotros as a source of challenge to the exercise, and that is what we are doing. If tomorrow the taxi should fall within, nothing will stop us from carrying the exercise.
You heard that Superintendent Kwesi Fori, his Director of Operations for the Greater Accra, for the Accra region. Now, still in Accra, over 20 head porters and their children are currently being held by the AMA task force on the high street. This comes a day after a similar truck with scores of women and children was impounded at a drizzle by the NTTD. Head of Public Affairs for the Accra Metropolitan Assembly, Gilbert Ankra, tells Joy News the outfit is currently cooperating with the police on the way forward.
So yesterday in the evening, we had our men who went around to monitor the situation. This morning they came around to do extra patrols, and they found a vehicle parked just behind the Building Power Hall. So they approached the vehicle to find out what's happening, because earlier on, per their normal monitoring, they didn't find any vehicle around. So when they saw this vehicle, they were quite curious to look into it. So they approached the vehicle only to open it and then find a lot of women being carried with their.
My colleague PSA Nanaya Safo is monitoring that situation for us. He joins us live. PSA, you've been interacting with some of these porters who are pleading with authorities to allow them go back home. Tell us more.
Yes, Emefa, for the scores of headquarters here, the state can only grant them one wish, as we've communicated earlier, that's to send them back home to Wale and its environs in the north, from which they have come to operate here. For many of them, the information we gathered is that they went to Odona, there's the Odona lorry station, for tickets on Saturday, trying to beat the Sunday deadline for the lockdown. But unfortunately, after a driver, they say, who had taken some funds from them, that's about 150 cedis individually for a seat, and plus 80 cedis and others for mattress and others, they could not find the driver anywhere. That means they had been cheated out of their funds. So they had to beg another driver who originally transports yams, we understand, to the north, and that's how they ended up in the truck in the first place. At Nkoko, right before they could even get closer to Kumasi, they were stopped on Saturday night, we are told. They attempted to return back, and yesterday they left the areas at around the morning hours and reached Odona. They reached the area, that's Accra High Street, today at dawn, and that's their fate now. I spoke with one lady, Nafisa Amidi, who further explained the ordeal they had gone through to get to where they are. Let's take a listen.
Friday no ana ade asi Saturday ana omoka chena say yambra na umufa yanko ka na maye na yada sa ma ade achi omusika baba ka baba
Saturday ku si Sunday
ka baba sa ka na maye ana me brawe sesenu ana o say yaka chena say ono wolo de bayere say Tamala Bankran. Akata ne say sanakane obetna de akwa ya peyashi akọ sabanya kwa de akwa wan sra na onfa ya ne ma no fa ya ka ho na ntimi kodru eye adwuma ya wasudu ya da ho na ya da nso ya so aka ya ana ya ne bebi ya da no ya ne dem nti ya nkọ chie ne nkọ tena chie sayala no ba fama ya betna saba Africa credit.
So that's a head porter there interacting with my colleague PSC Nanaya Osafo, essentially pleading with authorities to allow them go to where they've come from, Wale because of the situation that has been recorded in Accra as a result of the spread of the coronavirus and the restrictions. They're saying they are homeless, so they would rather be in their home region than be here. Now, the story is not bad everywhere. Our checks at Newtown here in Accra reveals people are generally abiding by the directives. Joseph Akable has the rest of the story.
Empty. Kojo, a commercial bus driver, is parked by the roadside, but finding passengers remains a challenge.
They
very boring.
They have reduced the number of passengers we can take. At first we take 10, now just 6. It's difficult to even get 3. People are not moving about because they are scared of the virus.
There are few people walking along the streets, mostly to buy food.
Okay, the patronage to the place was very bad and very poor because of the incident that has happened. Nobody wants to come out to come and buy anything. They don't want to get infected.
But even before you get over to your workplace, you've come here to buy food.
Okay, from where I'm coming from now, it's okay. People are indoors, they don't come out. I have my protective items in my bag, so whenever
What are those items? What and what?
My nose masks and my hand gloves, so when I get into the car, I just put them on.
A popular Wachi joint operated by Haji Alima is not as busy as it usually is.
We thank God that at least few people are showing up, but it's not encouraging. A lot of people have food at home now. The few who can't cook come here. We need God's help in these times.
Some residents of Newtown here in Accra, but there's a reason to stay at home. Around the world, people are dying, and the situation does not look exciting at all. The main reason for the cases and deaths has been movement of people. My colleague Fifi Kumsin looks at the global picture in the following report.
In the United States, the coronavirus has killed more than 3,000 people.
By very vigorously following these guidelines, we could save more than 1 million American lives. Think of that, 1 million American lives.
Infections now stand at 160,714.
Our future is in our own hands, and the choices and sacrifices we make will determine the fate of this virus and really the fate of our victory. We will have a great victory.
But that victory is yet to come. Globally, there are now close to 800,000 infections, with nearly 38,000 deaths. The virus continues to debilitate economies around the world. In Australia and New Zealand, there is a high proportion of young people among those diagnosed with the coronavirus. 37% of cases are among young people between 20 and 39 years. In Italy, more than 101,000 people have been infected, with 11,500 deaths. Spain has recorded 88,000 infections, with 7,700 deaths. Germany has 67,000 cases, with 650 deaths. In France, 3,000 people have been killed and more than 44,000 infections recorded. The UK death toll has reached 1,408.
I can report that through the government's ongoing monitoring and testing programme, as of today, 134,946 people have the virus, 112,805 have tested negative, 22,141 have tested positive.
Its Prime Minister Boris Johnson has himself tested positive for the virus. Britons have been warned of the potential for blackouts amid growing fears that staff shortages could lead to issues with the country's power network. Fears are growing that the high levels of staff sickness during the coronavirus outbreak, mixed with the government's self-isolation rules, could lead to a shortage of engineers. Hong Kong will now have to reimpose a lockdown after fresh infections began sweeping through the nation, despite an earlier success. The WHO's concern is about the strain on health systems around the world.
Previous outbreaks have demonstrated that when health systems are overwhelmed, deaths due to vaccine preventable and treatable conditions increase dramatically. Even though we are in the midst of a crisis, essential health services must continue. Babies are still being born. Vaccines must still be delivered. And people still need life-saving treatment.
Director Tedros Adhanom, the world now faces an existential threat. The cure: stay at home, get tested, and get treated.
So that's the message. Stay at home. Once you stop moving, the virus will certainly stop moving as well. Our top stories in this edition: COVID-19 patient from Guinea put in quarantine in Tamale escapes. And as we speak, police has launched a manhunt to look out for her. And also, still to come, Ghana Health Service to begin house-to-house testing of people suspected to be carrying the coronavirus in high-risk communities in Ashanti region. Also later in the bulletin, the singing campaign to raise awareness about COVID-19.
There comes a time when we hear a certain call, when the world can't come together as one. There are people dying. It's time to us a hand to prevent worse disease right now.
UMB was established in 1972 as the premier bank for the corporate and private sector in Ghana. From our very beginning, as the only Ghanaian bank serving all categories of businesses, we set a standard for excellence and innovation over the past 45 years. We've built a financially healthy and strong bank, demonstrated our commitment to our customers and to growing businesses, and exhibited originality and innovation at every turn. At UMB, our focus is built around people, service, products, and technology. These are the key to our present success and our future triumphs. At UMB, we're poised to make a difference not only with our customers, but also in the banking industry. We invite you to share in our future. Our future starts now with you.
The Midday News is also live on myjoyonline.com, also on Facebook Live, all our social media platforms as well. Let's do sports now. Benedict.
Now, the Tokyo Olympic Games will start on July 23, 2021 and run to August 8 after being postponed for a year because of the coronavirus pandemic. Now, the Olympics will still be called the Tokyo 2020 despite taking place in 2021. With over 12 months to the Games, Ghana's boxing coach Ofori Asare is looking at how they can build the capacity of the two qualified boxers to do well.
This is a situation which all is up to the International Olympic Committee, because as you keep on, as the postponement keep on coming, all these kind of problems will also come up. So they are planning will have to affect all. But on our part, we know that Suleiman Tete doesn't have any problem in terms of growth. Yes. He's already at 27 and has no growth.
So that's Coach Ofori Asare, who is Ghana's amateur boxing coach. Now, UEFA will hold a crisis conference call with its 55 members tomorrow to discuss Champions League dates, transfer window, and players' contracts. Now, European football, just like sports across the globe, is currently on hold due to the coronavirus pandemic, with Spain and Italy being the countries, where the hardest hits. But the governing body for Europe are keen to try and get a plan in place so they are ready once football is able to resume again. That's your sports.
Thank you very much, Benedict. Let's head to the Ashanti region now, where the Ghana Health Service is to begin a house-to-house testing of people suspected to be carrying the coronavirus in some high-risk communities in the region. My colleague Ohiming Teria has been following this development. He joins us on the line. What's the situation? Hello, Heming.
Hello, Emefa.
So tell us more about this exercise to be conducted by the Ghana Health Service.
Yes, Emefa, according to the regional health authorities, this exercise is geared towards bringing the spread of COVID-19 to an end, not only in Ashanti region, but in Ghana. He says the move is to ensure that people who are not exhibiting the symptoms of COVID-19 could be smoked out and attended to. Deputy Regional Director in charge of Public Health, Dr. Yao Ofori-Yeboah, explains.
We have 9 confirmed cases in the Ashanti region, and currently there are 284 contacts that we are following. But to help us bring this infection to an end at a very short notice, we are going beyond following these 284 contacts. And there are reasons for that. The key objective is to ensure that every single individual with the infection, whether the person is showing symptoms or not, we are able to identify these individuals and immediately put in measures to care for the affected individuals. So that is the core objective.
You heard that the Deputy Regional Director in charge of Public Health, Dr. Yao Ofori-Yeboah, in the Ashanti region, head of Health Desk, Fred Smith, joins us on the line with Ghana's situation when it comes to COVID-19. What is it currently as we speak, Fred?
Well, MFA, officially, what we've been told is that 152 cases remain, and I'll give you the breakdown. The routine surveillance has recorded 63 cases. About 2 of them have recovered. 56 of them are well or are responding to treatment. 5 we know have died, and no one is in critical condition. Ghana's situation under mandatory quarantine for those who are in Accra, 79 and 79 are still well or under treatment. No deaths from this group. But we had 10 yesterday from the mandatory quarantine in Tamale, and of the 10, we have 1 of them escaping, as you reported earlier on. My understanding is that cases have significantly jumped, but we're yet to hear from official sources about that.
That's the head of our health desk here, Fred Smith. Thank you very much. Now let's head to Parliament because the Finance Minister, Ken Ofori-Atta, is expected back in the House later today to request financial approval for the coronavirus alleviation program. Joseph Opoku-Gakpo is in Parliament. He joins us on the line. Joseph, what else is happening in Parliament? What are we to expect? Hello, Joseph. Okay, so if you can hear me, Joseph, I'm asking what to expect as the Finance Minister comes to the House later today for financial approval.
So he is expected to lay the document for the coronavirus alleviation program, which will eventually be referred to the Committee on Finance to probably return with a report. And you're expecting that document will spell out specifically who is likely to benefit from what stimulus package as far as the 1 billion cedis he announced yesterday is concerned.
That's my colleague Joseph Opoku-Gakpo, our parliamentary correspondent there, bringing us the latest updates. Of course, our eyes and ears will be in Parliament for more on that. Now, the restrictions imposed by government has left many at home doing various things. And some have decided to release songs on social media to create awareness about the fast-spreading COVID-19. Listen to this and stay safe.
There comes a time when we hear a certain call, when the world can't come together as one. There are people dying. It's time to us and to prevent world disease right now. There comes a time when we hear a certain call, when the world can't come together as one. There are people dying. It's time to us and to prevent the world disease right now. We can go on pretending day by day that someone somewhere will soon find a cure. We are all part of one great big quarantine.
What's yours? I'm sure whilst you're home, you can start using your creative juices to compose something to curb the spread of COVID-19. Our top stories in this edition: a patient in quarantine out of the 10 that were tested from Guinea in Tamale has escaped, and police is currently on a manhunt. We heard from the Northern Regional Minister on that. There's more news when you log on to myjournalonline.com. I am Emefa Apawu. Thanks so much for your company. Stay home, stay safe. Once you stop moving, the virus will also stop moving.
For you and me.